Before we can get into the basics of good dental care, we need to review quickly what teeth the horse actually has in their head, where they're located, so you know what to be watching for. Every horse will have a minimum of 36 teeth, male and female. There will be 24 molars, 6 on each side, top and bottom. There will be 12 incisors, 6 on the top, 6 on the bottom, for a total of 36 teeth in all males and females. There are a few teeth that are gender specific or somewhat gender specific. The first of these, and probably one of the least understood, is the wolf tooth. The wolf tooth is a very small tooth that appears directly in front of the first molar. The wolf tooth is about the size of your eye tooth. It's a useless tooth in the horse's mouth. Theory is it was a 7th molar at some time in front of that other tooth. We don't really know, we don't really care. All we know is we don't need it now. It does no good to the horse at best. At worst, it's an aggravation and irritation to the horse simply because it's set so loosely in the tooth socket. In fact, it's very rare to find a skull that has a wolf tooth in it, since most of the time it sets loosely in there, the wolf tooth is lost by the time the skull is down to bone. What we need to do in every case on this time is extract the wolf tooth. It's a very simple extraction. It can be done in the field. It's a very low trauma experience for the horse. The only times there may be problems are what we call blind wolf teeth or displaced wolf teeth, if it's coming in the wrong place, if it's not coming through the gum line and maybe is growing along the jawbone instead of through the gum line. Now this will require a sterile process under clinical conditions, but otherwise a wolf tooth can be extracted in the field, should be extracted. They appear when a horse is 1 to 2 years old ordinarily. Prominent in male horses, every male horse will have both wolf teeth just virtually without fail. Since they appear between 1 and 2, it's common practice for the wolf teeth to be extracted while the horse is sedated for castration if it's a young male horse that is going to be castrated. The veterinarian will extract the wolf teeth at this time if they are through, and most of them will be through the gum line. There will be some cases where either they're not through or the horse is going to be kept as a stud, and in this case you should check the horse before they're bitted for the first time. Before you begin working or riding this horse, have them checked for wolf teeth and get these wolf teeth extracted if they are through before you put pressure on the mouth. Fillies, which are not subject to the castration process and oft-time are never checked for wolf teeth because people are under the misconception that fillies don't get wolf teeth, should be checked. About half the fillies that I've examined have at least one wolf tooth. Many of them will have both wolf teeth, and in fact some of the bigger wolf teeth I have ever seen have come out of fillies. So if you have fillies, don't assume that the wolf teeth aren't going to be there and where you don't get them checked. You need to get the fillies checked and get wolf teeth extracted if they're there. The other tooth, which is gender specific, is the canine tooth. Now these appear on top and bottom in the bars area, which is this smooth gum area between the incisors and the molars. The canines are a large fang-looking tooth. They appear when the horse is 5 years old, so you won't see them in your young horses, but when the horse is an adult horse at 5 years old, you'll find your canines.